How many times have you heard Bernie say this?
And certainly Medicare for all. Radical idea a few years ago, not so radical today.
But what if I told you Milton Friedman, one of the most influential economists of the 20th century, warned us about it decades ago? That's why today's video is not to be missed. By the way, we just rebranded the channel, so it helps with the algorithm and better reflects our mission, but don't worry, the content you know is staying exactly the same. So hit the subscribe button and welcome to the first video of Red, White, and Rational.
Healthcare is a human right.
Healthcare is absolutely a human right, whether you're rich or whether you're poor or whether you are in the middle class. That's point number one. Point number two, and what we say to our conservative friends who talk about waste every single day, there is no healthcare system in the world that comes close to being as wasteful and bureaucratic as our system. We recently, a couple of months ago, I had the ambassador from Denmark visiting the state of Vermont. They provide health care to all of their people without out-of-pocket expense at 50% of what we are spending when we end up having tens of millions of people uninsured, people paying large co-payments and deductibles. So to our conservative friends, if you want to stop wasting money, let's pass the cost-effective way to provide universal health care to all of our people, and that is through a single-payer system.
Bernie has been repeating some version of this same message for years now, to the point where it honestly feels like a broken record. The problem is, the speech itself never really evolved either. For someone who we just witnessed attacking the modern healthcare bureaucracy, I think it's worth pointing out that much of it was created and expanded by the Democrats. Another point is, his solution to reducing the said bureaucracy somehow involves making the government even bigger. I mean, you seriously can't make this up. It's like he's completely ignored the issues Obamacare already created. But during a 1978 speech, Milton Friedman completely dismantled the logic behind government-controlled healthcare. So let's just see what he had to say.
I believe that this trend, including many of the steps that have already been taken, is very much against the interests of patients, of physicians, and of other healthcare personnel. To begin with, a greater involvement of government in medicine may seem to serve the interests of at least the purveyors of medical care by providing an additional source of finance. This is a honey that has led persons in industry after industry to support and promote governmental involvement, which has reacted ultimately against them. In the medical case, the initial inducement is that here is a new source of money. And presumably this is why organized medicine has been schizophrenic about the trend toward government involvement. It has, on the one hand, tended to protest against the move toward socialized medicine. It has, on the other hand, engaged in activities which have promoted that development.
This is played out almost word for word. And if we take Obamacare as an example, which is arguably the first major stepping stone towards a broader Medicare for all style system, when it was first introduced, insurance companies were sending some mixed signals. Some were cautious, others publicly supported it, and many eventually got fully behind the law once they saw there was money to be made. But fast forward roughly 16 years, and the reality looks pretty different. Many smaller insurers were pushed out of the entire markets as larger corporations consolidated power. In many places, competition has been gutted to the point where some areas only have a single plan available for those trying to enroll. This is the exact point Milton expanded on next, and I think he made some solid arguments.
The trend toward increasing government involvement in healthcare is not an isolated phenomenon. It is not restricted to healthcare. It is part of a general trend in our society toward replacing voluntary free market arrangements by government control and regulation. It is a trend that is happening all over. It has happened in one industry after another. There is nothing special in this respect about the move to replacing private voluntary medical arrangements with compulsory governmental arrangements. When the government is taking over any activity, there is more money available. But what typically happens is once the government has taken it over, the situation changes. There are no more votes to be gotten by taking it over some more. You have to move on to new fields and take over new areas in order to get some new votes. And the result of that is that those areas already taken over get starved. And instead of there being more resources available, there are fewer. You invariably get lower quality and a lower quantity of medical care.
Exactly. Just look at New York City. Despite already having some of the most generous welfare systems in both the city and the state, Mamdani still managed to win support by promising even more government involvement in the economy. One of the clearest examples was his push for municipally backed grocery stores. And honestly, that really tells you everything. Once Pandora's box gets opened, it rarely stops there. These programs create even more long-term dependence on inefficient government programs rather than actually solving the underlying issues. And of course, none of this is free. The money always has to come from somewhere. And by now, I'm sure you already know where. But Milton put it into words so eloquently that it's absolutely worth hearing.
The argument is being made that all of this is necessary because there has somehow been a terrible rise in hospital costs, which the American people either cannot afford or can somehow be eliminated by wise government bureaucrats. Most of these stories always deal with the benefits that will be received and say nothing about who is going to pay the cost. There is only one source from which the costs can be paid, and that is the American people. I say to people who say we have to have government medicine in there, I say, would you mind first telling me which of the other great reforms of government have achieved their objectives? I take it you mean the federal housing program has solved the problem of housing for the low-income groups? I take it you mean that the federal welfare program has solved the problems of welfare and indigence and dependence? That federal urban renewal and housing and reconstruction programs have solved the problem of urban blight? Well, the people, after all, are catching up. So I think it is not entirely hopeless that we can stop this march and turn it back.
Well, with the affordability crisis still hitting hard, promises of free things are gaining more traction than ever in modern politics. And while many people understand the long-term dangers of that approach, some candidates are still managing to win enough support to get into office by selling those ideas. The problem is, those promises often create even deeper government dependence while putting massive strain on already bloated budgets. In many cities and states, we are now seeing higher taxes piled on top of growing debt, which doesn't actually solve the problem. It just kicks the can down the road. And who ends up paying for that? Future generations, who will be left dealing with the consequences of today's political short-term thinking.